Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter P, and today I'm going to talk about portal vein diseases. I start from the introduction about the portal vein and what are the common diseases and the causes, etiology and mechanism, and also talk about the emergency situation about regarding to this portal vein diseases. When we talk about the portal vein diseases, probably the most important portal vein diseases came to my mind. One is the pressure in the portal vein system elevated, and the second one is the thrombosis in the portal vein system. So this is the emergency situation occurred with the portal vein blood pressure elevated. That's because the pressure built up in the portal venous system cause the venous structure start to change and also increase the risk of bleeding. So the most, I think, significant or serious complication for this is the vomiting blood. If that's the case, usually it occurs with those who had chronic liver disease, either caused by the virus infection, for example, hepatitis B, hepatitis C, or by long term of the alcohol. So if that's the case, if you have about 3 risk factors, long-term chronic hepatitis by the hepatitis virus B or C, or long-term alcohol caused cirrhosis. If that's the case, vomiting blood, a huge amount. So if that's the case, that's definitely an emergency. I think it's not quite common because of the advancement of medication, but I think 2 or 3, 4 decades ago, it's quite common. In Asian country, in China, I know a lot. The hepatitis B, it's really the main cause of this portal venous system hypertension, causes vomiting blood. It's not uncommon at all, either from the just internal medicine, digestive system, or a digestive specialist, or the surgeries see this all the time. It's quite urgent. So that's the emergency situation. In terms of the manage at home, probably if you had this from chronic hepatic disease, you can not manage at home. You have to be managed by the physician, even though the management is the supplement of nutrients, or supplement of vitamins, or irons, just the decreased complications, but still need to be under guidance from your professional, your doctors, your specialist. So you cannot manage at home. So let me just talk about the portal vein. This is the portal venous system. It's occurred in the liver, along with the hepatic artery, hepatic vein. There's extra of venous system, but full of nutrients. This venous system, portal vein system, is collect the blood from the digestive system, from the gut, from the small intestine, for example. So after the absorption of your food, either your carbohydrates, your whatever, after you eat, so the small intestine process, and the stomach, of course, grinding and absorption through the small intestine. And those first line of the absorption cannot just go to the blood directly, because there's so many things the body need to make sure it's safe. So those nutrients will collect through the portal venous system, through the mesenteric blood vessels, going to the portal vein, to the liver. The function of liver is detoxification, and also to metabolize, to like the first line of process before release to the blood. So the liver will further break down those molecules, and also will detoxification. If something is not healthy, the liver will degrade those components. So that's the importance of the portal vein. And the portal venous system branching inside of the liver along the bile duct, and also the micro capillaries, accompanied them together around this hepatic lobule structure. So that is the under microscopic, but you do not have to know it. But anyway, so this is the structure of this portal vein. The portal vein hypertension, which means the blood pressure build up in the portal vein because of the cirrhosis of the liver. The portal vein is the lobule structure surrounded by the fibrous tissues. So if those fibrous tissues get extended, take over the normal lobule hepatic structure. So that's called fibrosis. So those fibrotic tissue will cause the blood pressure buildup in the portal venous system. So like the virus infection, hepatitis B or C, or long-term alcohol, first of all cause the cirrhosis of this liver. And the cirrhosis, which is the fibrosis, cause the cirrhosis, increase the portal venous pressure. So clinical presentations, in addition to the hepatic symptoms, like the beginning probably nausea, vomiting, sometimes may have jaundice, and sometimes may not have jaundice, just a lot of patients, I think a long time ago, present to the clinic just as the huge amount of vomiting of blood, because the patient did not know or did not have access to the health system. So just live with that until the moment the blood vessels under the esophagus, so it's just getting thinned and congested, and suddenly becomes bleeding, huge problem. And I think later on, because of the special surgical management, the bridging, and also to treat the hepatic disease, the immunizations. So this portal vein hypertension, I think, decreased a huge proportion or percentage. It's not quite common as before. But anyway, so this is about the portal venous hypertension. In terms of the significance of this video, it's just for those who had risk factors, need to really follow the guidance with your physician. If you drinking alcohol long term, take vitamin B's, B6, B2, B1 even, and niacin, and also B12 to prevent all the complications, possible complications. Or if those you had hepatitis B positive or had a history of hepatitis C positive, so that's also the same message applied to those people also. Follow your physician's guidance and take the supplement of the nutrients to delay the progress of the cirrhosis. So in terms of the thrombosis of the portal venous system, usually it's from the systemic thrombi found there, or just the formed thrombosis locally, or the emboli from the system. And the problem probably clinical presentation, abdominal pain, and usually it's kind of subtle, hard to find the causes unless the imaging study and history of other emboli or thrombus diseases. So and probably it's not that common. Usually it's probably it's part of the mesenteric thrombosis. Sometimes it's related. So I'm just going to stop here, and I hope this video helped, and also most importantly trigger your interest to search more about the portal vein, about the liver structure and the function of the liver associated with the digestive system and digestive diseases. So I'm going to stop here today, and thank you for watching. I will see you next time.